All right. My name is Josh. I'm a student physical therapist at Concordia St. Paul. Is it all right if I work with you today?
Absolutely.
Awesome. So I kind of read over your case a little bit. Coming in here, I read over your paperwork that you gave us. But kind of just, in your own words, just tell me about what happened and what brings you in today.
Mm-hmm. Yep. So as you know, I had that leg amputation recently, and yeah, it's been quite the challenge getting used to not having a limb anymore, and still dealing with some residual pain, and sometimes feels like my limb is still there, or I have weird sensations like some pain and numbness, tingling, that sort of thing. Even then, it usually goes away, but I have to kind of rub it or look at it, or kind of just goes away on its own. But yeah, it's been quite the challenge since the amputation.
Absolutely. Yeah, a lot of people that experience amputations have these types of symptoms. So I'm glad you came in, but it's definitely something that we can help you with. One of the things that seems to, sort of exacerbate what's going on right now is, people that are dealing with pain often have other things that are going on outside of their life. Is there anything really that's going on typically right now in your daily life that seems to be, sort of adding stress and just, kind of weighing on you a little bit more?
A little bit. I'm a single mother putting a daughter through college right now, so that is kind of financial stress on top of the cost associated with all the medical care I've been receiving. Having an amputation's not cheap, so that's been kind of a lot to deal with. And then just another thing I've been stressing about is getting ready for this upcoming spring break trip with my daughter. We are going to the Caribbean, but I'm a little bit worried about my ability to get around. So might have to break that trip up into 2 smaller trips, but I hope to be able to go with her and do it all in one.
Sure. Yeah, so, like you said, just, reading back what you kind of told me is, the stresses of putting the daughter through college. I have children of my own. I know that's tough.
Yep.
Financially, and, them not being at home, I can understand that. And then also you talk about, you wanting to have fun with her during that trip, and being able to get around might be difficult. Things of that nature, and just like the social anxieties that come with having that. I totally understand, where you're coming from, and I want to be able to help you move past those so we can reduce your pain here and make you, get rid of that. So one of the things, have you ever heard of the cup theory before?
I have not.
Yeah, so the cup theory talks about, looks at a cup right here, right? So, you always, whatever you drink out of. The analogy is that in life, sometimes when you have your stressors, say your daughter's, putting her through college, and you have the financial stresses, and maybe you have a little bit of anxiety of her not being at home with you, and you want to hang out with her. That's another thing that goes in there. Or the social stresses of, walking around or getting around without, having a prosthetic limb in place right now. Like that, sure. Are all things that are added stress in our life, and the more you add those into the cup, it can eventually get overflown. And when things like that begin to overflow, it's hard for our pain to go away, and it's hard for us to manage that pain, and it can actually make it worse. So essentially here at therapy, what we want to do with you is, we know those stresses are going to be there. It's just, how can we manage them? Can we make our cup bigger? Can we find ways to make your cup bigger to be able to handle more stressors, or be able to get rid of some of those stressors and think about them in a little different way, with the end goal in mind is to improve your pain. Does that make sense to you?
Yeah, I think that's a wonderful analogy.
Yeah, so that's one of the things that we help do here in therapy. So based on my subjective interviewing with my patient, I would turn to my CI and start talking about the type of mechanism of pain that she's having. So right now, I would say this is falling under the neuropathic category, given that she's having the phantom limb pain going on right now. So that's involving our neurological pathways that start down all the way in our legs, and even the one that's not there right now, and moving all the way up into those same pathways that are going up to our brain. So right now, that pathway is just a little bit hindered. So with our therapy, we should be able to help fix that. I do also think that this is falling moving into the nociplastic category as well. She's about 8 weeks post-op, and this condition has potential to move to a more chronic level, even though it's kind of, I think, already overlapping and kind of in that little bit gray area where it's moving into that category. So if we can get on this early, hopefully it doesn't continue and make problems worse in the future. But I think if we get on that right now, we can try to reverse this process and help her get into a prosthetic limb before things get worse. All right, so thank you for sharing a little bit more background about you and your life, and kind of how a lot of the events that have gone on have influenced us and how we got here. Your story is really important to me. So moving forward then, we want to talk about your pain. You've mentioned it. I want to talk with you about ways that we can help you get rid of that pain and manage that pain. So have you ever heard of graded motor imagery before?
I have not.
Yeah, so with graded motor imagery, some of the things that it can work with are conditions like chronic pain, CRPS, which is chronic regional pain syndrome, spinal cord injuries, stroke, peripheral nerve injuries, and then as well as phantom limb pain, which is essentially what you're having right now, which is that pain in the limb that's not there at the moment. But these are all conditions that cause disruption in the brain's messaging center, which, if left untreated, they can become very serious down the line and bring on a whole lot more complications where they can be a little bit harder to deal with on a daily basis. So it's a good thing that we got you here right now, and we can work on this condition and see improvements with your pain. So these aren't necessarily injuries to the brain itself, but just the pathways that we have talked about that start down here and deliver those signals up to the brain. So there's more of an issue there versus like an actual physical issue to the brain.
Interesting.
And then are you wondering about what techniques or treatments are available to help decrease those pain and get back to your normal activities?
Absolutely.
Perfect. Yeah. So we use this technique is used to help normalize that body map. So our brain has a huge image of our entire body and where it is laid out, and right now there's a little bit of an issue with that, given that we have an amputation. Your body hasn't necessarily adjusted to that yet. So there's 3 steps involved, and it starts with laterality training, then moves to what we call explicit motor imagery, and then finally ends up with mirror therapy. And with each of those, there's separate protocols within each that we can discuss here. But before we move on to the next step, we always have to master the one that we start with. So before we go on to 2 and 3, we have to be really good at 1. So just building a good skill set to help us move forward and have all the skills we need to practice more interventions to help with your pain. So the best thing about this, though, is that we're on your time with your pain. We want to have your symptoms and whatever you feel and experience drive where we start and where we finish. So it's really all about you. It's a very personalized program to you. It's not one specific thing that works for everybody. It's really about how you respond and what we're capable of. And so we'll be able to help you figure those out. So the first step, though, is the laterality training, which I will explain here with the cards. You can do it physically with your cards here, but you can also do them with other apps that online. I don't know if you would rather use your phone or maybe an iPad. A couple of the apps are called Recognize or Orientate, which we can discuss later at the end of the session. But essentially what laterality training is doing is helping the body identify between left and right again. So sometimes with an injury such as your own, the brain sometimes gets confused as to what's right and left, and it's hard to differentiate between it sometimes. So we have some not necessarily problems, but we have some things that we want to clean up, and we can help that with our laterality training here. So we're going to start with some images of a hand first before we would maybe move to some images of feet. But here, essentially, you would start with a card here, and you would tell me if this is a left or right hand.
That's a left hand.
Good. And then same thing here.
That is a right hand.
Good. So this is what we would do for our laterality training. Again, you can do it with the flashcards or online. The goal, though, is to do this as fast as possible and as accurate as possible. So really trying to train the brain is going, yep, that's a left, that's a right. In other scenarios that I've done in clinic with other patients, we've done at home, if you don't want to get these or don't have access to the flashcards online, you can take a magazine and be able to go through those quickly and circle all the right hands of the people, or all the right eyes of the people, or all the right legs of the people. That's just like a little bit of progression that we can get to. However, for this, before we move on to the next one, we always want, like I said earlier, we want to be able to master this. So mastery for in this scenario would be to accurately identify 85 to 90% of 20 to 25 images in less than 2 seconds per image. So once we get to that point, you're going to do a lot of different practicing. We can do this roughly 1 to 3 times per day for 3 to 10 minutes at a time is really like our standard protocol for this, which we can start out by doing. And once we start to get that mastery down from there, we'd be able to move on to the next step, which for us, the next step would be explicit motor imagery. So earlier when we were talking, we discussed our, our movements and our activities that kind of give us maybe a little of anxiety or maybe a little bit of pain in that limb, or just really we feel uncomfortable with at the time. So the goal of this is to think about those activities that are giving you issues and kind of organize those in most difficult to least difficult, or most painful to least painful. And we want to start by thinking about the activities that are least painful first, and we just want to imagine ourselves doing those activities pain-free. So like I said, you're going to come up with that list. We're going to start with that, go through there from the least painful, imagine those steps, and essentially mastery would be, again, when you're able to imagine this task you want to accomplish with your affected limb not having pain during that. And that would be our step 2. And then finally, we would move on to the last step, which would be our mirror therapy. All right, so as discussed, the final step into our graded motor imagery is the mirror therapy. So mirror therapy, you may or may not have seen this before, but mirror therapy essentially is trying to trick the brain into believing that your leg that has the amputation is moving pain-free and symptom-free, just like it is with the other leg. So it's just a little trick that we have as therapists to help reduce some of that pain for you and think about activities and you doing those activities pain-free. So essentially what we're going to do here is we're going to put this in the middle, like so, where now I have this right down the middle, and my right leg, which would be my unaffected leg, is here, and it's creating a mirror image of me on the other side down here with my foot.
Yeah.
So this is what it's just going to start to look like this, and I'm going to actually have you do it, and I'm going to walk you through the steps.
Okay. So you said right leg in the...
Yep.
Oh yeah, wow.
So first thing I want you to do, though, is just to observe this here, and I'm going to get out of your way because I don't want to block anything. I want there to just be a good, clear image of your foot there.
Yeah, it's kind of weird.
Yeah, and when you look down at that mirror right now, where would you rate your scale, or rate your pain on a scale from 0 to 10, 0 being nothing at all, 10 being maximal pain?
Like a 5.
Like a 5 right now? Okay. So given that we had, we moved to this therapy unless we had mastered the other 2 as well. So when we're imagining and we're thinking about those activities that we're doing, there's some movements that we're going to want to practice working with, and thinking about those movements that we had talked about before that you want to be able to do that have given you pain in the past. So just for like right now, I want you just to try to move this foot up and then back down and up and back down. Good. Just keep doing that a couple times. If you're here, we would just do this and hang out here for about 1 to 3 minutes, roughly, which could be progressed to even longer. But I think a good start for us right now would be in that 1 to 3 minute category. And I would ask, tell me about your symptoms right now. Do you feel like they're being relieved, or do you feel they're getting worse or about the same?
I feel like the pain is getting better. I feel it less on my amputation side.
Good. Yeah, and that would be, the point of this. And once we've, started with small movements like this, and we've started with, even before that, backing up, just thinking about movements with this leg while, you have the mirror there and imagining those without pain. Once we start to master that, we can move further on and do more advanced movements with this leg and progress from there.
Okay. Yeah.
Yep.
Sweet.
As part of my final discussion with my CI, just to clean up things with the mirror therapy, I would have discussed with my patient, talking about the mastery would have been achieved when they have less fear, feel more confident, when they think about or move their affected or amputated limb. They notice changes in symptoms, or they have more control over their symptoms, and overall decreased pain. So I would explain that to my patient. And then my 2 helpful hints for a therapist that would be performing this modality would be to make sure that the image is not skewed by the background, and then also not having distractions. So make sure the environment's set up. We're in a closed room, no other distractions going on. It's quiet environment, so really closing that environment to the patient. And giving them as much time as they need to focus on this. And then also creating a proper starting point in the goal, in controlling or managing the symptoms as the patient works through all 3 steps. So again, I'd done this in the video of asking about, where's your pain level? And then also, collecting that, the movements that have been giving them issues, and then start lower on that end and not to overwhelm them too quickly. So small exacerbations can also be allowed if the patient can return to their normal baseline that we had established with the patient through that subjective interviewing. Furthermore, with graded motor imagery, just remember that there's also various protocols. There's a standard protocol, a fast protocol, and a high symptom protocol. Essentially, you can maybe start with the standard protocol, but just more so seeing what works best for the patient and what they respond to the best. So those are within the manual of the graded motor imagery. And then finally, moving back to kind of the start with more so talking about their social determinants of health. We had kind of touched on the social aspects, so walking around with a prosthetic limb versus not having one to use at this time. So she's just going to feel a little bit more essentially normal or not stand out as much. So just being able to address that with her as one of those. And then another one would be the economic stability. So putting a child through college at age 41, which means she had the kid at 19. So that's obviously tough to do. So kind of talking about those social determinants with her and how those affect her, which we had done with the cup theory as well. And then building off that, the educational piece. So being that she was 19, she had mentioned that she wasn't able to go into school at that time, so she doesn't have an extensive knowledge about everything here. So really using good patient-friendly language with that to help talk about it is good. And then lastly, to wrap up, with the cup theory, we talked about the things that add into her cup. And then just mentioning that, there's some things that we can do to make the cup bigger, essentially, and manage her pain. But then also talking with her during when explaining the cup theory, we can say things like how to flip those things that are stressors in her life. So, for instance, right now, going on the trip seems like it's a lot. But if you kind of flip the mentality about that, or maybe use a different perspective, I get to go on a trip with my daughter who maybe I don't see as often as I want to, but also now I get to spend quality time with them. So again, just talking more about how to flip those ideas in the cup theory, and then also being able to take them out of the cup, but then also make the cup bigger. So those are just my final thoughts on the graded motor imagery.